somewhat.
Sorry, Martha.
No, you're good. It's been a humbling process, sorting through all of this information and trying to get it to um, come together as a coherent slate. And so I'm really grateful to have your input today. I'm going to run through just an update of where we are in the process, what we heard from you all in your survey. I know there's about 40 minutes on the agenda. I don't know if we're going to use all that time up front or maybe have the presentation about where we are with policy recommendations, a bit of discussion, and then go into the discussion of the other two parts, and then sort of come back and say, hey, is there anything missing from what we heard about policy recommendations? Because really where we are as a system, as an organization, is understanding how to connect the dots between policy recommendations, strategic plans, other strategic plans that are living within the system. So just really grateful for all of your thinking and brainstorming today around that. There's so much that is urgent for children and families in the system. And we are on the policy team, doing that sorting function of what's an actionable policy recommendation for this year, what's things that live in our strategic plan, and what are things we're supporting in other people's strategic plans. So I hope that makes some sense, and that with Kate's help and Katie's help with facilitating today, we can kind of make the most of our time in that area. So I'm going to share some slides with you to give you an update on where we are with the strategic planning process to kick that conversation off. Are you all seeing my buddy here on the swing set?
No, not yet, Martha.
Not yet.
Or maybe, yes.
Okay. So here we are. Code Committee Policy Recommendation Discussion Part 2. Martha learning how to advance her slides. Here we go. So just a little bit of grounding of how we do this process of developing policy recommendations, identifying the needs, sort of what we did in the summer and with our survey, considering next steps and gathering expertise throughout the network and partners. This is where we are now, gathering expert and lived experience through networks and partners. And we will be having a draft slate for feedback in October, for SAC endorsement in November. There's just that same information on a timeline for those of us that do better with timelines. Wanted to give you all an overview of what is bubbling up from other committees, so you sort of have the full landscape. So the data and evaluation team is talking, or committee is talking about a recommendation around prioritizing data privacy to protect Vermonters from federal overreach. There's just some concerns about how our data is being stored and potentially used. And so our data and evaluation team is looking at that and best practices in light of current events. Second, data evaluation is looking at investing in CIS, including implementing a statewide data system. So those are two things bubbling up there. The Early Learning and Development Committee is looking at a recommendation around ECE professionalization that fits within the workforce sort of scope of our strategic plan and is potentially connected to licensure. Recommendation around UPK that carries forward the Pre-K Education Implementation Committee recs and also speaks to ed transformation. Another recommendation the ELD is working on is protecting CCFAP and Act 76 investments. That's all the sort of progress investments that have been made in childcare in the system in recent years, just protecting that through the budget process. And then lastly, ELD is working on a fingerprinting recommendation. And a couple of these are also sort of in consultation with the PPD, Professional Preparation and Development Committee. And then the Families and Communities Committee is very aligned with this committee in prioritizing support for basic needs and healthcare and nutrition, and also working on a recommendation around family and community voice. So we generally are looking for a total slate of 10 to 12 policy recommendations. It's a bit of a moving target at this point, but we're hoping to come in that window. So you all had the opportunity to complete a survey in August to give your input on what potential recommendations you would like to see COAT consider, what your prioritization would be. This is a snapshot of the outcome of that survey. You can see ensuring families have economic supports to meet their basic needs. The bullets got cut off here, so I fleshed them out over here. So economic basic needs came in at the highest priority, and that sort of also broke into these more specific categories of maintaining supplemental nutrition supports and maintaining Medicaid coverage for all children and families. And also coming in at that 60% priority was invest in affordable housing and transitional housing supports and emergency shelter. As you can see, there's these other areas that still, are important and necessary to keep an eye on and keep working on. And I think this is where this sorting conversation begins of, what are the actionable policy recommendations for this cycle, and what are the things that we're watching, monitoring, working towards in other spaces. So I think we'll talk more about these policies in child welfare, trauma-informed visitation, and what was the other 40% one? Increase investment in community. I'll have to go back to the survey and remind myself what the rest of that bullet is, but I can do that. So the big takeaway here is similar to the Families and Communities Committee. There's a real sense of, on this feedback that we received, that access to basic needs in this particular cycle needs to be a priority. So here's some draft language that we have developed along these two areas, and healthcare and nutrition access. The first, ensure children and family nutritional needs are met in the face of federal funding cuts, maintain current eligibility and benefit levels for nutrition programs, including 3 Squares Vermont, WIC, and Universal School Meals. Continue to improve access to CCFAP. And then second, to ensure healthcare and mental health care access in the face of federal funding cuts, maintain current eligibility and benefit levels for Medicaid and related health services for all, regardless of citizenship or immigration status. So I wanted to kind of pause there and give the room, or the chat or the Zoom room, an opportunity to kind of reflect on those two recommendations, and just, do they resonate with what you were trying to tell us was important? And there anything that you would add, change, or rearrange with those two recommendations? And I know this is the first time you're seeing them and like being put on the spot. There will be a survey going out. You'll have the opportunity, for those of us that are more introverted and need to sit quietly with things in our own, there'll be time for that. But I just wanted to pause here this morning, just if there's any sort of popcorn reactions to that draft language.
Feel free to raise hands or come off mute. I see Renee has her hand raised. Thanks, Renee.
Great, jump in, Renee.
Yes. Introvert acting extroverted in these spaces. As someone who did not have a chance to complete the survey and is coming in at the 11th hour, overall, these make sense to me. I think what's interesting that I would raise in terms of ensuring child and family nutritional needs are met. In the Head Start world, we've actually seen support from the Trump administration around nutrition. They actually put out a pot of funding for Head Start programs, specifically around increasing access to nutritious foods and farm to local programming work. So all of our Head Start programs did apply, and I think the awards were just announced last week. So just wanted to elevate that I agree with this completely. And in terms of the conversations about the federal landscape and kind of what's being targeted, I would just think this one to me feels more secure. Not that we don't need to mention it, but just wanted to say that this one to me doesn't feel as threatened as, for example, like the healthcare and mental health care access and those pieces. So just wanted to put a plug in there. We actually are seeing additional funding coming out for nutrition services. So that's a positive. And we'll probably hit on it in another place, but have had some recent conversations with the state McKinney-Vento coordinator around some potential strategies related to McKinney-Vento work that would directly support basic needs and specifically in this area around housing. So I know we're just on healthcare and nutrition, so I'll go back off mute, but wanted to put a plug in that based on some recent conversations, I think there's some potential around a policy recommendation related to supporting McKinney-Vento funding.
Amazing. We will get to that in a couple of slides, Renee, so please stay, please jump in. Kaya.
Okay, sorry, I'm having computer challenges today. So I love how you included the citizenship or immigration status under healthcare. I do think there is a point of including that caveat explicitly under child and family nutritional needs because SNAP has already been cut for people who have immigration or citizenship status that is being questioned or not supported by the Trump administration. So I would love to see that explicitly called out in the first bullet too.
Great. Thank you for that. Yeah, there's a lot of language to chase down in these federal changes, and but I appreciate you elevating that needs to be across the board for sure. Any other hands that I'm not seeing? Okay. Like I said, there'll be more opportunities, or if you have a, a light bulb moment later in the day, you can always send me an email or Anna or Kate, and then there'll be a survey coming out in a few weeks with this. These were just, well, let's skip ahead. Let's talk about the housing recommendation, because the housing recommendation is, and I see that Bev is here, so maybe with some help from Bev and some help from Renee, we can move this forward. But last year's housing recommendation for BBF was a big, big, burly thing, and it had three parts. It had a piece on ensuring emergency shelter and homelessness supports for families. It had a second section around sort of the service delivery of housing stability, getting people into transitional housing and keeping them in transitional housing. And then it had a third piece that was sort of investment in housing infrastructure and more units. And this is an incredibly complex policy landscape. There's a huge number of partners in it. And so the question that we've been chewing on as a policy team is, given that, what is BBF's value add specifically in the early childhood space? And as much as last year it felt important to put forward that policy recommendation that sort of saw the whole spectrum of the issue, we're really trying to be curious this year about is there a more targeted recommendation that has relevance? And so I would love to hear from Renee, from Bev, from anybody else on this call, if you think that, if you have ideas in that area or thoughts about the value of BBF keeping this on our agenda, even if we're more just saying, hey, do what those other folks are already saying we need to do. Renee, do you want to share the McKinney-Vento date?
Or I was trying to get Bev to go first. Trying to step back, I promise. Yeah, the McKinney-Vento, because I recognize BBF. We've had this conversation, and just as you put it, Martha, it's like this is a big issue. It's complex. We've got other partners who are leading. And I think when I did the first take on the draft, it did feel very focused on infrastructure, which we know we need. But I've been meeting monthly with the McKinney-Vento coordinator, and it just, kind of occurred to me, it's like McKinney-Vento is a specific area that we are focusing on the impact of homelessness on kids and families and making sure that those kids' basic needs are being met in terms of their education and their access to education. So it felt to me like McKinney-Vento might be a vein for us that brings us a little closer to early childhood. Um, uh, Katie Preston also, kind of shared with me just in terms of the numbers, the state of Vermont is really awarded, I think it's a little over $300,000 for the whole state to work on McKinney-Vento. After the AOE takes its cut, it ends up being about 245,000 that's available for Vermont communities. It's a competitive process in our state because the funding is so limited. So school districts have to apply for funds. So McKinney-Vento liaisons are not necessarily present in every LEA. This year they received 16 applications with a total, which is nothing in the drop of LEAs and school districts that we have. And the total request of those 16 applications was around $600,000, which is double what the state allocation is in total. So, we've been meeting and just talking about, again, the needs of this population. 85% of the requests that come in through McKinney-Vento are around transportation. I'm excited about the way that BBF is looking at the strategic plan and really highlighting transportation because that's an undertow. But access to evaluations, for IEPs, IFSPs, there's so many ways that I feel like we're trying to support the most vulnerable, and yet we've kind of overlooked this young population of kids and families experiencing homelessness. And, the emergency shelter and all of that, I support those spaces, but I've also, we've also seen high numbers of young children in those spaces, which aren't conducive for child development. They don't have any activities. There's no kitchen for cooking. So I guess I come before the committee. And now my default changed. Come to this group just seeing if there might be opportunity to focus. I can even with.
Oops, we're losing you a little bit, or I am.
Renee, could you remind us, does McKinney-Vento support kids in early care and education as well as in the school system?
It should. Yes, it's federally mandated that these are kids 0 to 21, I believe. It's the same under special education. I'd have to go back, but we are talking about, yes, it does impact 0 to 5.
Okay.
And that's what we're seeing, right? Is we're seeing that kids might be in public school settings. They might be older children who are picked up, right? And then there's similar responsibilities to child find. It's like, well, if you're working with a student in 4th grade who's experiencing homelessness and they have a 3-year-old brother, that in theory, McKinney-Vento, we should be working with that family to connect that entire family with the services and supports that they need.
And can you remind me, this is federally funded?
McKinney-Vento is federally funded. It is right now in the federal landscape. It's proposed as flat funding. Yep. I
mean, I certainly feel like it's I'm glad you raised it. I think it's really important to, I think it'd be really important to put in the policy recommendations and not lose sight of that because I think it's sometimes gets less attention. And I agree that it's really, really important. I think are you proposing it be the only housing recommendation or in addition to?
No, this just seems like while we have other strong housing partners in the state who are really elevating that message of we need infrastructure, we need this, McKinney-Vento seems like a niche for BBF to really focus on the impact of homelessness on children. So I would say it's an addition. It's not replacing these things, but that we know that the housing infrastructure is not led by BBF. Whereas in the McKinney-Vento space, it doesn't seem like there's anyone right now who's championing championing the work specifically with this population.
I'll pause because I see that Kaya has appropriately raised her hand, so I'll pull back for a minute.
So my question is, when we're talking, and I love the work that gets done because of this funding. Um, however, should we, I'm not quite sure how to phrase this, so bear with my weird introvert mumblings here. So I know that, like you said, we had 600K in requests for the funding compared to the little bit that we had. Should we be thinking about, even though I know that it's not going to be a popular suggestion with, tightening budgets and stuff, that the state actually starts looking at pitching in some funding so these families are covered. You know what I mean? It seems, I get it's a competitive process. I'm really tired of the nonprofit world making us act like a pool of sharks feeding off the same thing, rather than saying, what is the need? What is the funding need? Where is the shortfall? This is where we see you need to put dollars, and having realistic budgets. Not just, okay, we know there's $100,000. We're going to try to get 5,000 of it and do $20,000 worth of work. Should we really be starting to put some teeth into it and giving realistic numbers and supporting those numbers as a recommendation and as, something that we are pushing? So that's all.
I mean, I love
Okay.
it. I'm also mindful, right, of what everyone says about the current funding climate, right? That we should be happy and thankful to hold tight, right? And this is right, big asks and everyone's coming out for the money. So I love that direction. I don't think that we'd see it, but again, I think this is a step in terms of elevating the issue to even get people to start thinking like, oh, McKinney-Vento, yeah, what does that work look like? What is that? But yeah, I agree with you,
Yeah,
Kaya.
I don't think we'd see it either, but I don't,
Yeah.
you don't get anything by not asking.
Right.
And elevating and starting to pound people with it.
Yep. So what I'm hearing then is a potential recommendation that the state the state sort of match the federal funds for that McKinney-Vento. Is that okay? Is that capture somewhat?
I think it's a start, or look at, what the need is. Cause like I said, I understand the act, I've worked with it, but I don't know what the dollar pieces are right now. But I do think it's something that we should start considering, even if we don't ask for the match. So I think that's not a bad idea. Maybe we start saying we really need to put some teeth into what monies do we need to support the McKinney-Vento Act work in this state.
And this is a larger theme that we've been talking about just the shifting of the frame from are we funding the need or are we looking at the budget as just a math problem? And really being that voice for um what it would look like to truly fund the need. So I appreciate that being lifted up in this space as well. Bev, let's hear from you about other thoughts on housing in the early childhood space.
Well, I guess I have a few thoughts. One, I would say, lack of affordable housing affects families with young children as well. I agree that there are maybe other partners advocating for that in the state space. And I do think the lack of emergency shelter for children is an important question, or for families and children, because I think part of the reason we saw so many families in the hotels was because we don't have a lot of shelters that support just families with children. And so I know one of the things that's on my list of things to catch up on is that the state had proposed having some designated shelters for families with children. I mean, designated hotels, but that for families with children, but that I believe was still subject to the 80-day rule. And I don't know if that ever got implemented. And so one of my to-dos for this week is to follow up on whether that ever got implemented. The meeting where it was supposed to be discussed from the state got canceled and never got rescheduled. So I'm trying to find the status of that out. Maybe some of you know. So I think emergency shelter is still important, particularly as it relates to families with children. And I don't know that anybody else is specifically advocating or raising that up. I would say when I shared your recommendations with some of the people I work with in the housing community, Sarah Russell from the Chittenden County Homeless Alliance, and who also is the special assistant to the mayor for homelessness in Burlington, she raised up the issue, reminded me about the home voucher. So if we're getting more specific, like with McKinney-Vento, the home vouchers, I think, are another family-specific program that pairs wait, let me read this to you so we get it right. I put a link in the chat that is a new rapid rehousing voucher program for families experiencing homelessness, and it's modeled after the CARES housing voucher program. So it serves around 200 families, but it's due to expire at the end of June. And I believe while the CARES voucher was a model that was used with ARPA funds, I believe, as I understand, that the home voucher may be funded by state dollars, maybe through the HOPS grants. But I have to refresh my memory on all of that. But the homes voucher, I put a link in it. It expires at the end of June. I think it would be a model worth raising up as well if we're going to talk about specific efforts around housing that focus on families with children. And so this model provides supportive intensive case management as well as some housing subsidy.
Thank you, Beth. We'll look into that and connect offline as well. Katie, what did you want to add?
Thought I have when I look at the recommendations here, and I love the very specific links to ongoing work that's happening. But I think about the different levels of support. There's the emergency shelter, then there's more like housing, long-term housing. And then I think about the piece which is equity building for families. And what we tend to do is build a bunch of low-income apartments that people get help to rent, but they never build equity and they don't get the space their family needs. And so I'm not saying we need to necessarily write a recommendation around this, but when I think about our lowest income Vermonters, I just think about all the loss of potential equity that when we just give them a 2-bedroom unit that we pay for, they never get to build that and they get stuck.
Yeah, I think that's an important and underexplored component of goal 1. We have a basic, then sort of the economic security. What does economic security really look like beyond survival? And there is policy in that space. There is research in that space we can look into as well, make sure that's there. Renee is back.
Yeah, just riffing a little bit on Katie, I love that. And it feels to me like this is a place too where we could leverage families and communities to really explore this issue of housing and what families need most and how that works. Like yes, and it seems like we have this pool where we could also go a little bit with deeper with families around thinking about that equity that they're building. And, I'm not sure if those housing conversations have come up with the families and communities committee.
Yeah, that's a great question. I can reach out to those co-chairs and
I really do appreciate this idea of thinking about like what are the housing solutions for families, because up till now we've been kind of supporting the larger housing picture and creating housing for everybody, and I think that the funding for that is maybe not going to be as available, and so maybe some of these smaller, more focused efforts might have more energy. So I think but we haven't really had a coalition of people interested to, or is anyone taking the lead on that specifically? So I love this discussion so much.
And look at that, Renee just called Jen forward from the chat. Jen, do you want to jump in? Jen is the co-chair of the Families and Communities Committee.
Yes, I've been sitting here wanting to raise my hand, but didn't want to interrupt the conversation you had going. So a lot of our interests in this committee and Families and Communities Committee are very aligned, and that is a conversation we've had the last 2 months in our committee meeting for the Families and Communities. And a lot of the parents had showed interest in wanting to connect with this group, and we're trying to figure out a way to make that happen. Whether that be inviting more parents to come and join this group, maybe have a leadership team or something from this group come and attend our Families and Communities Committee, making another third meeting, which I know could be very hectic. But that is something that our committee has shown a lot of interest in, specifically because our interests are aligned with the policy recommendations in both of these two committees. So any suggestions would be helpful. I'm happy to obviously be the communicator between the two committees. But I know parents would love to hear a lot of these conversations that are being had. One suggestion I had was to leave some time in our committee meeting to kind of review some of the notes and topics that are discussed here. But I'm not, some of these getting everybody together just will create more rich conversations than me just reiterating what was said. So any suggestions would be very helpful.
Yeah, I think that's such an important conversation to bring into both spaces. And I appreciate that, Beth is here, and I know this ongoing conversation around monitoring and governance of the strategic plan is an evolving one. And I hope that the right sort of constellation of folks can be brought together to open some channels for that dialogue to happen. And I think it sounds like where we are right now is at sort of a brainstorming space. And Jen, let's connect again with maybe Kate and Tanya and think about just in the short term over the next few months how we can make sure to do that well. I see Kaya's hand, and then I'm going to move us on to kind of the last section because we did take up our full 40 minutes. Okay, go ahead.
So just a short comment on wearing my hat as my actual position. I also would love to see not only building supports for families, and I love the equity conversation. I'd love to be a part of that. Thought the building in Burlington where they were actually selling units and condos was really interesting, but I'd love to include some kind of reference to trauma prevention. If we're really trying to look at people's health and things like that, this social driver of health is so essential in building thriving communities, which is, I think, what we're trying to get at with housing. So just some wordsmithing, but I would love to see some kind of trauma or trauma responsiveness built in here.
Great. And that's actually a really great segue to the last piece. Is sort of like the what's missing. What is missing from these recommendations? What do we want to maybe consider bringing into this year's recommendations? And then what are the things we want to hold on to in the strategic plan and being in dialogue with these other strategic plans? So before I pass it on to Katie to talk about those, this was just a comment that sort of summarized a couple of comments that came through on the survey, which was increased financial support for substance use disorder housing, especially recovery housing for women with children, support for universal nurse home visiting, and the full postpartum service, inclusion of OB services as patient-centered medical homes for the Blueprint for Health, and increased capacity for care coordination, case management of high-risk pregnancy and postpartum people. So that's a big mouthful, but I think that just opens the doors into this landscape of trauma-informed perinatal and early childhood, holistic trauma-informed system of care for families in that time frame. And again, the things that we had talked about in terms of like trauma-informed parent-child visitation and other how other systems can be more trained and I don't want to say effective because that's a judgmental word, but can be more comfortable working in spaces with family violence. Some of those conversations have happened in this committee and feel really important, but aren't so much landing right now in a policy recommendation. So I want us to hold on to that track that Kaya just put back in our heads of like, what does this trauma-informed, holistic system look like, and how do we keep
Trauma responsive, please. I've really been trying to shift the language in the state.
Thank you for correcting me. A trauma responsive system of care, and how do we keep moving in that direction? So before I officially pass the baton, I also want to just ground us in somewhat where these recommendations are come from within our current working draft of the strategic plan. So goal 1, all children and families have their basic needs met, and that is where sort of housing, food, income, and transportation live in that space. And then goal 2, all children are raised in safe and healthy healing environments. So healthcare, mental health care, the substance use disorder sort of constellation is, I think, currently living in this goal. So as we're thinking again about there's so many needs in the community, and they're also interconnected, thinking about what is an actionable policy recommendation for this year's legislative cycle versus what are the strategies, the longer term strategies that need to live in our strategic plan versus what are, those pieces that VDH or the Early Childhood Alliance or others are moving forward in their policy recommendations and strategic plans, and how do we align with that and support that. So I'm going to let Katie speak, and then invite if we want to just revisit via email or in this conversation, kind of in light of what Katie says, if there's things you want to add. I'd love to hear that. But just my final word is just like where we are next October, you'll look for a feedback survey from us, and then for these to be approved by the SAC at the end of November. The last sort of asterisk I have to say in these meetings, unfortunately, given where we are federally, is, as you probably know, we don't have a federal budget right now beyond September 30th. And so we are moving forward in the current landscape as we can see it, knowing that there may be, if there's seismic changes at the federal level, we will have to reevaluate all of it. So that's our asterisk. Thank you so much for the discussion, and I'm gonna pass it back to Kate and Katie.
Thanks so much, Martha, and thanks everyone for the rich discussion. Katie, if you want to kick us off, I will bring up the screen share for us.
I actually added a
You have
slide
it?
to my slide deck, so do you mind if I screen share and see if
Yeah.
it works? Okay.
Go for it.
All right, let's see. Oops, that's not what I want to do. All right, let's see. Hold on one second. Let me just. Okay. Oops. Am I sharing it or not? No, right? It just covered my full screen. That's why. Okay. Give me 1 second.
Not yet, and I made you a co-host, so that might be easy.
Okay. Is this sharing correctly?
It's sharing as in presentation. We can see the notes.
Okay. All right. Maybe you should just share it, and I'll just add stuff in the chat that I want to add. I think that's easier.
No problem.
All right.
How's that?
Yeah, that's good. Thank you. So I just thank you all for taking a minute to listen today. So this is the Maternal Health Strategic Plan draft, and I should have put draft in big bold letters because this is a first go round for a strategic plan that we are required to write for a maternal health innovation grant, but also recognizing that we haven't had one really. It's focusing on maternal health in Vermont specifically. So We did a process where we did a survey and we did 2 listening sessions virtually, and then we had a full day summit in July. And we had hundreds of participants across all of those formats, really giving us a lot of feedback on the current landscape of maternal health and what people want to see and what they, the changes they hope to make in our healthcare system and our community health system. And so what I'm going to show you today is a very high level presentation. It's not going into a lot of the specific strategies recommended. It's more of the broad strokes. I'm going to have you go to the next slide. Just a quick statement on language, just that the Division of Family and Child Health recognizes all gender identities, including those in the perinatal space. So we really want to make sure that we understand that we use specific terms, some related to federal requirements, some related to clinical designations, but our approach is always to be inclusive, respectful, and sensitive. So just to note that. Next slide, please. So just a quick thing on what this is. So Maternal Health Innovation Grant, we got this year as our first of a 5-year grant, and it is aimed at reducing maternal mortality and severe maternal morbidity. So maternal mortality is death to a person in the pregnancy through 1 year postpartum period, and severe maternal morbidity is severe health outcomes related to pregnancy or birth or postpartum period. So the other goal is to advance sustainable improvements in maternal health service delivery, data collection, and policy development. So the goals here: improve access to care that's comprehensive, high quality, appropriate, and ongoing throughout the preconception, prenatal, labor and delivery, and postpartum periods. And again, that postpartum period we talk about it is that full year after birth or end of a pregnancy. And enhancing the state maternal health surveillance and data capacity. And then the third one is identify and implement innovative interventions to improve outcomes for populations disproportionately impacted by maternal morbidity and severe maternal mortality and severe maternal morbidity. Oof, I'm getting myself tangled up. And so you'll see we used these goals as the sort of scaffolding for our strategic plan. And so you'll see them repeated throughout this presentation. Next slide, please. So, like I said, we did a pretty comprehensive conversation with providers and community partners and people with the experience of birthing across the state to come up with this outcome that all birthing people in Vermont feel safe, supported, and empowered during their pregnancies, births, and throughout their postpartum experiences. So that's kind of the overall vision of what we're hoping to see. Next slide, please. I'm going to talk really quickly about 2 different topics before we move into the strategic plan, also pieces of this picture for maternal health innovations. So one is the Maternal Health Task Force. So this is a requirement of the grant, but also something we hope will be useful and productive. So it's basically the idea that we will take a lot of these perinatal health efforts that we have in multiple spaces and organize them under sort of one umbrella and one approach. And it's jointly led and organized and administrated by our own division, Family and Child Health, but also the Perinatal Quality Collaborative of Vermont. And we have a partner here, Julie, who's going to talk a little bit about that in a second. It's consisting, we haven't pulled it together yet, so nobody's missing out if you haven't heard about this. It's being developed right now, but it's going to consist of diverse leaders across state government, hospitals, community partners, individuals with lived experience. We want it to be comprehensive and representative of viewpoints across the state, but we also obviously want to keep it a little bit smaller and a little more organized. And so we have different mechanisms for more engagement as well. So the activities of the task force will be to receive the feedback and make edits on this draft strategic plan. So this is a draft. We're going to have a lot of time to receive feedback and we'll have a lot of conversations around the finalizing of this plan. And then they're going to also establish governance mechanisms within the grants, and then have some oversight and management of the plan that's developed. They're also going to manage some technical assistance to support ongoing coordination and for community partners and things like that. And then there'll be also an opportunity for people to engage on more specific topics in work groups as well. So the task force is going to be hopefully a little more of a smaller, more mobile group of folks. And then there's going to be a lot of work groups for people to engage in. And then also we're going to have this next project, which will be on the next slide, and it's our major sort of innovation of this grant. And I am going to invite my colleague, Julie, to jump in here if she feels comfortable.
All right. Can you guys hear me? Yes.
Yeah.
Okay. First of all, can I just say one thing about BBF and your process that I just witnessed, and all of you going through recommendation and strategic plan? It's pretty impressive. As we are starting to work on this maternal health innovation strategic plan, which seems like a baby compared to what you guys are doing, but really impressive work. So I'm here just as so VCHIP will be part of this project with the health department and FCH. And our role here is to really support these regional perinatal quality collaborative. And this is a state investment in regional partnership that will be really try to pull in leaders that are already working on these issues, supporting pregnant people, postpartum people, and family, but really kind of come in with a little bit more tangible resource and financial resource to really scaffold what they've already been doing, and kind of organize them a little bit better. And our role will be, so that's most of our work at VCHIP will be for the regional PQC that we call. It's a model that's been it's an approach that has been how can I say that has been done in New Hampshire, in Michigan, and we're excited to just come in and really help the teams on the ground that are working in the region. As Katie mentioned, the maternal strategic plan that's being developed will be, it's a little bit like what you guys do at BBF, will be kind of the roadmap or the blueprint for these teams to create small project that will become, if you see the last bullet here, really kind of the think tank innovative hubs where people will be kind of looking at their gaps in their region, and then come up with project that can support filling up these gaps. And our team at VCHIP will be here really to try to get, organize them in terms of quality improvement measure, support monitoring and evaluation of these innovation to see if they can be replicated in other places in Vermont, or just maybe let go if they're not responding to those needs. But super exciting idea to just come in and not reinvent the wheel, not kind of start something new, but just really come in and support those champions. And the goal is really to try to, which is very difficult, as we know, bring in clinical folks and community folks together to work together on these projects. And I can see that, I'm sure there will be overlap with some of your BBF work out there with your council. And supported by that, I just want to make a plug for our family advisors. So we do work with 11 family advisors that have given birth in Vermont, that have families in Vermont that are from across the state. And these guys will also be part of these teams and help organize that work with the rest of them. And I think I only had one slide, right, Katie?
Yeah, just a quick high level kind of
perfect.
Yeah, about how we're going to be doing the state level work, but then also really pulling together the communities and increasing that collaboration in the maternal health space. All right, next slide, please. So this, oh, I did have this in here. I forgot this. I was going to put it in the chat. Well, I'll put it in the chat too. And okay, so I'm going to be talking about the, like I said, the super sort of brief, high level strategic plan here, and you can provide feedback. And we really want people to provide feedback on this form because it really helps us to be able to pull together and not have to search our emails and pull out different, you know, so this is really, really lovely. People opt to use this form as I'm going through it. And this, the other thing I want to point out about this is I'm doing a real quick high level presentation here, but we also are reaching out to specific provider groups as well as regionals. We're going to go in person live to different regions and present this as well. So you're probably going to get sick of this strategic plan, but this is just like a first high level look at it. All right, next slide, please. Oh, Beverly, did you have a question before I?
No, that's okay. Somehow I thought that might be the end of the presentation, so let me listen to the rest now.
So goal one, like you saw on that one of the first few slides, is to improve access to care that's comprehensive, high quality, appropriate, and ongoing. So two of the high level strategies are create continuity of care for birthing people, supported by system integration, care coordination, and low barrier services. And then strategy B is to increase and expand support for the maternal health workforce to continue providing high quality service. So what you're seeing here are two things that kept coming up repeatedly throughout our entire feedback sessions and development of this plan is people feel the systems are siloed, which makes it difficult for providers in the community and clinical spaces, but also for birthing people themselves. And also between, I mean, there's just too much barriers to that communication and system integration. And then also there's the piece around so many barriers to access of different services. And then strategy B is looking more at that workforce itself and what we're seeing across, you know, the burnout and with the training needs and with the, you know, just the lack of actual, you know, providers themselves. And so how to kind of support that workforce. All right, next slide. Goal 2, enhance state maternal health surveillance and data capacity. So there's a lot of feedback we've been provided with we just don't understand what the maternal health data is in our state. And it's certainly also broken down by specific types of services or specific populations as well. So strategy A is to assess the maternal health landscape itself. Strategy B is to monitor new and ongoing programmatic initiatives and efforts to improve maternal health. And strategy C is to increase data sharing across agencies and partners. So kind of understanding what's out there for data, understanding how we can tell the story of the work that we're doing a little bit better, and then how to share that data more easily. Next slide, please. And then lastly, our goal 3, identify and implement innovative interventions. We have one strategy here, integrate community-based services and peer networks into the maternal health systems of care. That's that big high-level state goal. This is really the goal. Goal 1 and goal 3 in particular are really where our regional PQCs are going to shine and really elevate what is happening in their communities, what is working well, what did they try, didn't work well, how can they make that a sustainable and replicable intervention across the state, and then also to enhance that coordination in the regional level too. So both of those goals are really also going to be supported by the regional work as well. So we have the state level kind of broad strokes, and then we have a lot of those. We're really hoping that these regional PQCs will help that bidirectional information sharing for us. Next slide. So next steps, you can go on to the next one. I provided you with the strategic plan feedback form. You can use that form as many times as you want. You can go back to it. You can hear another presentation in the future with more detail and decide you want to give us more information, however you want to use it. But we would love some feedback by October 3rd around ranking which recommendations resonate the most, but that is not going to be your only opportunity to provide feedback. It's ongoing. And then we really want to know what we missed. We did listen and we did try to put these recommendations into words that we were hearing, but we know that they're big and they're broad. So if you have specificity, if you have more concrete actions, I'm really looking for you guys to help us here. And then stay involved and fill out our interest survey, which I also put in the chat here, to receive the newsletter, to let us know how you might be interested in getting involved, all of that good stuff. So, and these are all on our website, which I will put in the link as well. So everybody can have lots of links to explore. All of this stuff is on our maternal health innovations page. And that is it.
Great. I'll make sure to include those links in our notes too that go out. Any questions or comments for Katie or Julie? Steph, go ahead.
I
Jump
used
on in.
my real hand.
I saw it. Go ahead.
This is pretty high level, and so I'm going to ask a question that may not be appropriate here, but I was kind of, we're working a lot on trying to get Medicaid reimbursement for doula services, and just sharing with this group in case they're interested. The legislature did pass a bill last year, 2 sessions ago, and again last session, directing OPR to do some work around certifying, putting together a program to certify doulas so that they could be lined up and ready for Medicaid reimbursement. Directed the Department of Vermont Health Access to apply sometime by the end of next year to make doulas Medicaid eligible service in the Medicaid state plan. Right now, it's a federal optional service that states can ask for. Our state, I guess, has a lot on its plate, and we understand that it was kind of reluctant to do that. We understand that they may be coming back and asking to not have to do that at all. So that seems kind of in direct conflict with some of the work that the Department of Health is putting forward here. So I don't know that I have a question as much as a observation that I think helping families to get the services they need, particularly underserved communities, doulas could be an important strategy, and people can't access doula services if they don't have unless they can pay privately.
So nuance, as always. So part of maternal health innovations funding, as well as other funding sources like some other HRSA funding that we have called PCARES, which is another funding source. We have been supporting community-based doula programs for multiple years now. And there are currently 2 up and running and 2 coming on board for those community-based doula programs. And our division is committed to continuing to support them. And we can make recommendations around supportive services and promote those. And that's kind of what we can do as a division. We can't really speak to, what the larger, state legislature decides to do. But what I really want to point out too is our goal with this project is really, really to just pull together the resources we have right now, understand how they can better integrate, and then assess what is missing and what is not here. And so, if your region is missing doula supports, your regional PQC is a place to come and say, this is something we want to focus on. This is something we want to try to support. We want to understand how we can do it in a region. And then also understand, what else do we have? What early Head Start program do we have? What nurse home visiting program do we have? What are the other CIS services? What are, how are we as a community coming together to support families, whether or not we can control what our state legislature is deciding to do? So I think that's that the locus of sort of control of our communities is to understand, how to work better together, because we don't know what's coming with further funding in any of these programs.
Yeah. Well, I appreciate what you're doing and the support you've shown to the doula programs in these communities so far. I think you've been a very supportive partner from what I understand from the lead organization, the Doula Association of Vermont that we work with at the Alliance. We appreciate that partnership very much. I just wanted to sort of highlight that as an issue for the people on this call. Even though I know you're pretty familiar with it, and I just did want to, I understand the limitations of and where you are. I think the idea of trying to raise up what resources we have now is great. And you know, I guess that's what I would say for now. We understand that you can only do what you can do, and um and we appreciate the support that you've offered, and we think that, you know, we see this as an important strategy for moving forward into the future.
Yeah. Yes, thank you for that. And certainly encourage you definitely to put feedback in our interest survey. Like I said, put it in writing for us to you know, the more voices we have for including specific recommendations, then, you know, the stronger the, like I said.
And I think one thing that your project could do is it can raise awareness as to what doula services are and help people to understand that that's an option. So that they're at least aware of it, right? And we can help us to sort of assess where doula services exist and where they might need some more work to recruit and expand.
Yeah, can I add something? I feel like socializing people with this, I mean, Katie and her team and the extended F should put a lot of, I would say, backstage type of resource to kind of raise the doula with training and all this. But I think starting to more and more including the doulas in our you know, in our work and in our in these regional PQC will be part of that, you know, will lead to I think it's going to be for the best. I think where we are falling short all the time with our team is we don't really play too much in the advocacy space. So that's not what we do, but that's needed too. But if we in the PQC, we don't do that too much.
Well, and the maternal mortality review panel recommendations have noted doula care as part of its recommendations as well. So it's definitely, we elevate it in our advocacy, in our policy recommendations when it's appropriate for maternal mortality, because that has to be a little more specifically based on cases reviewed for the year. So it's a little bit different of a lens. But the maternal health innovations funding is supporting the doula infrastructure pieces of that work, because the PCARES funding supports some of the direct services in those regions, but the MHI is looking at it as a broader, like exactly like Julie said, like how do we bring doulas into the existing system of care more effectively in areas where they exist and in areas where they're starting up? How are we pulling them into the work that's already happening in the community so that families are able to understand, like, where is my doula care fit in with my nurse home visitor, with my early intervention, with my dual site provider in my pediatric office? You know, like all of those supports that exist in the communities can sometimes be overwhelming too. So for the regions that have them, I know that's like all piecemeal, except for children's integrated services and nurse home visiting is a little bit different, but a lot of these services are kind of regional right now. So how do we also help families understand the continuum of care and how and where to access the different supports and how they work together? And I think the biggest part for us to do is to do that back work with the providers themselves. Like, how are we working together so that when a family gets offered services, it's a team approach, and they are having to pick and choose and try to figure out how, you know, what they want.
I'm going to have to move
thank you.
us along, but if you have a quick comment.
Yeah, just a quick comment. Thank you. That's a helpful understanding. And are parent-child center networks part of this conversation?
When you say this conversation,
I'm sorry, the parent-child centers, are they part of this conversation?
I mean, some of the doula work is coming out of the parent-child centers. Is that what you're asking? I'm not totally sure.
No, I'm sorry. I switched gears from doulas to the overall innovation initiative. Sorry that wasn't clear.
Yeah, they are.
We have a lot of participation from parent-child center staff and leaders, but then also we're going to present the more detailed draft plan to them directly as well. And certainly we're also working with, like I said, going to regions in person. But we had participation pretty robustly from our partners throughout the process. They're huge partners, as everybody on this call knows.
I'm excited to see how that regional work plays out and in partnership with our regional councils. And Katie's been working with our regional managers to bring this presentation and this ongoing conversation with the regional councils, which will be another place where parent-child centers and early childhood educators will be at the table too. So that's great. Very exciting work. Thanks, Katie.
Think of the Maternal 2 plan by the end.
Yes, thank you, Julie. Thanks, Katie. I'm going to pull up my screen share one last time for a fairly short presentation. I'm going to try to leave space for discussion and questions too on the Vermont Early Childhood Strategic Plan. Give me one moment. Are you seeing my screen with the family and the baby? Somebody can give me a thumbs up or a yes.
Yes.
Great.
Yes.
Thanks. All right. So as I said, this will be a review for anyone who was at Monday's State Advisory Council meeting, and also hopefully is a review from the process that we have been engaged in throughout the last more than 9 months, really. We are updating this 5-year strategic plan for the whole state of Vermont. Building Bright Futures is sort of the steward and moves the process along, but the strategic plan is for the full Vermont early childhood system. And we are closing out to the VCAP of 2020 to 2025 and sharing with you today the 2026 to 2030 updated version. So like we talked a lot today about the different layers of strategic planning and policy recommendations and how all of this work sort of fits together. And I would say Valerie Wood, who's our BBS evaluator who's on this call, often calls the early childhood strategic plan the North Star. So it's sort of the mega plan, the plan of plans, where hopefully you see lots of alignment with other plans like the maternal health strategic plan, like the food security roadmap, like our state's climate action policy. We're trying to pull out where there's alignment, where there's priority, and where we can highlight the needs and the impacts specifically for our youngest children and their families. We also see this plan as a shared tool for diverse stakeholders, for families, policymakers, advocates, educators, and researchers, and the business community, so that we're all working towards a shared vision. We have some common language, and ideally, we're talking about clear objectives that include also some flexible strategies. You'll see language like example actions that hopefully help hold all of these different important issues in place. So the early childhood strategic plan that we're talking about, we're moving away from the acronym VCAP and we're just calling it the strategic plan. But if you hear VCAP, we are talking about the same thing. This is sort of the biggest high-level strategic plan, and then things like the policy recommendations, which happen on an annual process, will sort of sit within structure of the strategic plan here. So how this plan was built, a very fast and furious review of our process. In the springtime, we had in-person mostly and a little bit of online community conversations, both with about 100 caregivers and families and community partners throughout the state, and then another 100 or so early childhood professionals, the BBF network broadly, really to ask about a prioritization process. What is going well right now in the system? What do we really want to hold on to? And then what are the biggest challenges that we face? As part of that conversation, we also asked folks, including a group of 6th graders in the Northeast Kingdom, as well as those caregivers and family members, to write letters to share in their own words what is most top of mind and most going well and biggest challenges in their lives. So that's where we talk about the mixed method approach. All of that work over the spring was paired with the ongoing monitoring and data collection that we do at these strategic plan committees at BBF and throughout the early childhood system as part of BBF's statutory charge of monitoring the early childhood system. And then that's how we landed on the changes that we've made. So this is our vision. This is what we've discussed at the State Advisory Council meeting on Monday, had some discussion. We are still fine-tuning the language over the next couple of weeks. And then at the meeting on October 27th of the State Advisory Council, that's where we hope to have an official endorsement by the council itself. And we'll also be asking for sign-on and endorsement from community partners, from folks broadly in the early childhood system, to show that this is a plan with shared ownership throughout the state, that we have buy-in throughout the state, and that we're all in this together. So here is just a brief graphic to show you that we're moving from a 4-goal structure to 5 goals. There's some big changes that I'm going to highlight, and I'm going to do it in 3 minutes so that we have some time for questions and discussion and wrap up and get you out of here by 10:30. So you'll see, starting at the bottom in purple, our new goal 1 is focused specifically on basic needs. So this is where we talk about economic security, food security, housing, transportation. And unlike our former 4-goal structure, all children are healthy, have a healthy start. We're getting even more specific here, talking about goal 1, basic needs. Goal 2, health and safety. All children are raised in safe, healthy, and healing environments. These 2 goals is what Martha referred to at the end of her presentation. And goal 2 is probably the most similar to many of the topics that we've talked about here over the last year in our COAT meetings. This includes physical and mental health and well-being, social connections and social isolation, but also we've added language around climate resiliency, emergency response. Where do we hold when crises like our flood or multi-year flood recovery needs to happen? There's language around that and building infrastructure to really have some concrete strategies around what resilience looks like. Goal 3 is all children and families have access to high quality opportunities that promote child development and well-being. This is where we have early childhood education, child development, inclusion, and our practice of working to reduce or eliminate exclusionary discipline. This is probably the goal that we are fine-tuning the most over the next couple of weeks. And I'll share in the chat after I pull my screen share down the actual webpage that has the draft so you can read through it and share any feedback you have. Goal 4 is another update and prioritization that we didn't have in the previous strategic plan quite as clearly, which is a real focus on workforce. I was excited to see this overlap with some of what's been shared in the maternal health strategic plan also. Thinking about how children are supported by a well-prepared, well-supported early childhood workforce, and thinking about the early childhood workforce as including home visiting, mental health clinicians, PT, OT services, our pediatricians. We're thinking very broadly about workforce that includes all the intersecting pieces of the early childhood system, not just, not only our early childhood educators or early childhood education and care. And then finally, I'm right at 10:20. Goal 5 is our big system, data-driven, and well-resourced early childhood system that centers children and families. In the previous iteration of the strategic plan, we had goal 2, focusing on family leadership and family engagement, and then goal 4 on system integration and data-driven decision making. And in this version, we've integrated them together, and this was in part by a lot of work that's been happening both at Families and Communities Committee, but throughout the BBF network. The way that we've evolved our thinking around the expertise that families have and how we center the voices of folks who are most impacted by the early childhood system, as well as making sure that we have seats at the table for families when we are making data-driven decision making, both in qualitative and quantitative data collection. That was very fast and furious. Like I said, I'm gonna open it up now for any discussion or questions, or Beth, if you'd like to chime in and add anything, or anyone else from my team, while I put the web page link in the chat so you can read through the draft and get more information.
I thought that was a great, very brief summary. Nice job, Kate. I think the only thing I would add is just to, as we have a new strategic plan, BBF is examining what we need structurally to be able to monitor it. We already have a set of strategic plan committees we've called VCAP committees, and COAT has been one of them. And with new goals and priorities, we are needing to kind of respond to those, which means making some adjustments and changes to some of the committees, or establishing new ones, also trying to match it with our capacity. So I don't know that it means anything drastic for COAT. I think that the work of this committee lines up really well with goal 2, and that's probably where we will focus. But the committee will still need your engagement, both agency folks and community-based folks. So that's kind of where we're headed in terms of governance of goal 2, and in terms of the basic needs stuff. I'm sure there's going to be connections and alignment, and also BBF is also really looking at, like, how do we utilize the connections that we have with existing task forces around food security and housing and those types of things, instead of bringing together another group that would potentially overlap. So that's kind of our very short plan around governance. I have more that I'll share when we have a little bit more time and clarity.
Thanks, Beth.
Yeah.
Yeah, a couple questions. One is, Kate, could you please email me the link? Because once the chat closes, I don't have access to it.
Sure.
I always, try to remember to open the links, but then if my computer shuts down, I lose them. So just a note for anyone who shares links is, if you do, that some of us may not be able to access them after. And one of my questions, and it might be too specific for this conversation, but that I've been thinking about quite a bit, because I've been hearing tons about it for state employees, our governor's call for us to return to the office 3 days a week. Because we are 0 to 8, after school care has become an urgent cry and scream for people. And I was looking for figures, because I know I looked at the BBF last report, which was saying how many full-time slots up to age 5 we were short of. And I'm trying to find data on, up to 8, and does it exist? So that is the question. Is that something that we're sort of thinking of? Because, I know we're supposed to be 0 to 8, but a lot of our work is 0 to 5. That's
Great
all.
questions. Yeah, thank you, Kaya. And I'll make sure to include all of the notes, that the links that have been shared in the chat, I'll include in the notes that I email out for everyone. So hopefully they'll be in multiple places. And you raised an excellent point about after school, and we've been really intentional about working with our partners to make sure that when, similar to the point you raised around including the immigration and citizenship status in multiple policy recommendations, I think we've done a similar review where we can include after school language when we're talking about school and early childhood settings. Where can we be specifically highlighting the priority of after school? So in goal 1, our transportation objective says fund affordable public transportation to improve access, including routes for childcare, medical, and after school schedules. Just including that language a little bit more so that it's obvious that we're talking about, primary education settings and those additional secondary education.
You know what might be interesting too, though, when we're thinking about that, is inviting our partners in, or maybe in this group of the people, to think about outside the box when it comes to some of this. We are a rural state. So realistically, having public transport available for childcare, like after school or before school, is financially not feasible. So how do we do it? Is it we ask for more funding for school systems so they can run a separate route just for childcare? Things I would love to see some of that show up when we're starting to think about some of this. So that's all.
Yeah, and that makes me think about the importance of transitions between all of these spaces. And in goal 3, we have, aligning childcare, Head Start, pre-kindergarten, and after-school policies and funding so families experience seamless services across ages and settings. There's a lot that we could talk about there too, but that's just some of the language that we have included in the draft. Janet, go ahead.
Hey, I just had, are you still taking, I think you might have said, but you're still taking some comments? I know the plan is like almost done, but you are. Okay. Because on goal 2, I just wondered, we talk about healing environments, and which is great, but I wondered about the weaving in the concept of early relational health, and that has just become a huge thing in pediatrics. The American Academy of Pediatrics has made a joint statement policy brief, and it's really the relational aspect, and it's these upstream programs, which many of them are named in the plan, but that are supporting that nurturing initial relationship. Like doulas, the Dulce model, all these things that really intervene from the get-go to build those strong relationships with babies and their caregivers or parents. I just thought I might suggest some language, not to make it more academic or complicate, but it's not just like vaccinations. It's really this change of thinking about healthcare as more than just physical health, right? I mean, it's really that supporting that initial relationship. Okay, thank you.
Absolutely. Thank you, Janet. Yes. Feel free to, if you have any other comments between now and Friday, October 3rd is when we are trying to wrap up our comments and try to get it to really, so we have some time to finalize it before throughout October. So feel free to email me any specific language, and thank you, Janet, for your comment and the comments that you've added to our draft that we'll be incorporating. So one last housekeeping, we typically meet every other month. If we were to meet in November, we'd be meeting on Thanksgiving, and I'm sure that you probably don't want to be spending your time here for that holiday. So we are going to instead have an October meeting, and we are going to host that meeting on the typical 3rd or 4th Thursday of the month at 9 a.m. It's October 23rd. I'm going to update the calendar invite after this meeting, and we'll be having the Department of Health's consultants join us around the coordinated intake and referral systems study that they are doing, which maybe some folks here know better than I do, but they'll be talking with us about how systems can be improved around coordinated intake and referrals. So I'll send out some more information around that, but just tentatively so you have the heads up that we'll be moving our November meeting to October, and we will be talking about coordinated intake and referrals with Mathematica, the consultants with PDH, and then stay tuned for more updates around the strategic plan and our committee governance as that evolves and we are formally moving into monitoring the progress of the new updated plan. So thank you so much for your time today, and I hope you have a wonderful rest of your day. We covered a lot. Thanks so much. Bye-bye.